Hello students, this is Miss Hudson, one of your instructors here at San Diego Community College. I'm recording this short little video to discuss some things that you need to know as you get ready for clinical and some basic safety standards that we should be following with every resident and patient interaction. And if you can hear birds chirping in the background, that's because I'm recording this on my patio. All right, let's get started. The objectives for this tutorial, there are three. So you should first understand the basic safety protocols for every patient and resident interaction. Second, you should understand the importance of hand hygiene as an essential component of infection control. And third, identify and become familiar with reporting changes of condition to the charge nurse. All right, so basic safety protocols. In the clinical setting, we know safety is one of the most important things. Why? Well, as clinicians, it is upon our shoulders to provide a safe environment for the people we care for. Now, a lot of you are going to be working in skilled nursing facilities, and these residents are particularly vulnerable and fragile. So safety becomes even more of a crucial element of what we do. But safety is always important. So, how do we demonstrate safety? Well, first of all, we always do hand hygiene before and after every patient and resident interaction. I'm going to talk more about hand hygiene in a moment. Also, we want to identify the patient or resident before providing care. We want to have enough information about our assigned patients and residents. So that means you get a thorough report from the CNA that's going off shift. You also want to touch base with your charge nurse to make sure there's no new or updated information on any of your residents. Lastly, you always want to ask for help when you're unsure of how to proceed. If it's a skill you haven't done yet in the clinical setting, or it's a resident you don't know very well, or you got floated to another unit and you don't know the residents, always ask for help from more experienced staff. All right, hand hygiene. It's been proven in numerous studies that hand hygiene, effective hand hygiene, is the single best way to prevent the spread of infections in healthcare facilities. So, the CDC, the Centers for Disease Control and Prevention, have some excellent information about hand hygiene. So what I'd like you to do is just pause the video for a minute and look at this link on the CDC website about hand hygiene. Change of condition. So what do we classify as a change of condition? Well, a change of condition can be classified as anything that would be off of your patient's normal baseline. And what I mean by that is, once you get to know your residents, you're going to get to know what's normal for them. And that can vary from person to person. But you're going to get a feel for what their normal vital signs are, what the ranges are, how they normally communicate, what is their cognitive status, how they ambulate, their bowel and bladder status, so skin, what their skin looks like. So any variation from what is normal for them would be constituted as a change of condition. So what does this mean to you? Well, as the CNA, it is your responsibility to report any changes of condition that you see. You need to report that to the charge nurse, and then you document that you reported it. So when in doubt, report, because you won't get in trouble if you report something that turns out to be nothing. But you will be held accountable if you don't report something that you see and then something negative happens to the resident. So bringing it all together. So we know that as clinicians, we can positively or negatively affect those that are in our care. If we keep safety in mind at all times, this helps to ensure that we provide the highest level of care possible. That's what you'd want for yourself, and that's what you'd want for those you love. All right, students, thanks for taking the time to listen to this and watch this video. I look forward to working with each and every one of you, both in the classroom and the clinical setting. So until then, take care and stay safe.